Hi, my name is Dr. Rotimi Johnson. I am a board-certified vascular and interventional radiologist. Today I want to talk about fibroids. At the end of the talk, you should be familiar with what a fibroid is, what causes a fibroid, who gets a fibroid, what the signs and symptoms of fibroids are. You should be familiar with all the different types of treatments of fibroids, the medical treatments, the surgical treatments, the interventional, non-surgical treatments of fibroids. Let's talk about fibroids. Fibroids are tumors made out of smooth muscle cells. Okay? They are benign. Benign means that they are not cancer. Fibroids are found in the womb of a woman. Okay? They are found in the middle part of the womb, the muscle layer of the womb. Okay? Woman's womb, or uterus, it's also called uterus, that's a medical term for it. It's made up of three linings, or three parts. You have an inside lining called the endometrium. You have a middle lining called a myometrium. And you have an outside portion that is called serosa. Okay, so I'm going to be talking about that. But before I do that, I would like to talk about who gets a fibroid. Fibroids are more common as women begin to get older. So we see that in age 25 to 35, the incidence of fibroid is about 10 to 20%, and in 35 to 45, the incidence goes up by at least 10 points. Fibroids are more common in black women and less common in women of other races. Fibroids are also common in women who wait a long time to have a pregnancy or to conceive, and they are common in women who are heavy and obese. Patients who come with fibroid symptoms complain of heavy, prolonged menstrual bleeding. Okay, they complain of pelvic pain, back pain, pressure in the pelvis. Some of them come with anemia, low blood count. Some might complain of occasional loss of bladder control or bedwetting. Wake up in the morning and they wet their bed. So there are many symptoms of fibroids, but those are some of the ones that I'll highlight. Not all women who have fibroids need to be treated. The only fibroids that need to be treated are those that cause symptoms. When we do decide to treat fibroids, we have different types of treatments. We have the medical treatment, we have the surgical treatment, or we have the non-surgical interventional treatments. Now let's talk about the medical treatment. There are two classes of medication treatments for fibroids. The first one is the low-dose estrogen, progesterone combination, or they can be used separately. And these are present in the birth control pills that women take by mouth, or sometimes they can be placed in the uterus, inserted in the uterus as IUDs. And they only control the heavy bleeding, but they do quite well controlling the bleeding. They don't control the pain or pressure symptoms because they don't shrink the fibroids. The next class of drugs is called the GnRH analogs. This GnRH stands for gonadotropin-releasing hormones. These are the drugs that act in the part of the brain called the anterior pituitary, which is at the bottom of the place of the brain called hypothalamus. In fact, that's what controls the release of the sex hormone, the LH and the FSH that is needed for ovulation, and for control release of egg from the ovum. So what this drug does is it basically puts the woman in a menopause state. Okay, these drugs are usually given by IV. They're used for other things, but they're very effective in controlling the bleeding and also in the fibroids. But they do have major side effects that include very severe hot flashes, bone loss. So that's why they can only be used for 6 months. And they're typically used just to buy time before a woman is taken to surgery or to a procedure. So the two drugs that we talked about are the birth control pills that are made of estrogen and progestin, and the gonadotropin releasing hormone. The side effects of the estrogen progestin is they can have severe side effects that are uncommon. I mean, I've had patients who have had big liver tumors and also blood clotting called DVT. So we have to be careful about using those drugs too. The next treatment I'm going to talk about is the surgical treatment. And there are basically two types. There's the surgical treatment of fibroids. There's the surgical treatment that involves removing the entire uterus. Okay, that is called hysterectomy. There are many ways by which an hysterectomy can be performed, but an hysterectomy is basically removal of the uterus in a woman who's complaining of fibroids. To do that, a woman cannot have the ability to have children anymore. Okay, so that option is taken away. But hysterectomy is very effective because once the uterus is out, then there's no bleeding and there's no pressure symptoms. The other type of surgery for fibroid is the one that spares the uterus, and this is called a myomectomy. Okay, myomectomy involves also surgery. There are many ways to do it, but the commonality is that you make a cut in the uterus and you remove these fibroids. Myomectomy, a woman still has the option and the ability to have future pregnancies. There is also another type of surgery called endometrial ablation. Endometrial ablation is used to treat heavy menstrual bleeding. Okay? It involves placing a device inside the uterus and using heat or cold or radio frequency to burn the inner lining of the endometrium, and that treats the heavy bleeding. This is effective, but frequently many sessions have to be done to get the job done. Okay, now for the surgical treatment, irrespective of the type of surgery that is performed, surgery still carries with it a risk of bleeding, and the bleeding can be life-threatening. It carries a risk of infection, and it carries a risk of damage to nearby structures. There's a different treatment for fibroids, and these are the interventional treatments that are performed by interventional radiologists. There are two types, and I'm an interventional radiologist and I've performed hundreds of this procedure. There are two types. The first type is the uterine fibroid embolization or the uterine artery embolization. And the other type is called MRI guided ultrasound ablation of fibroids. The similarity between these two procedures is that there are no cuts that are made in the body. First, with uterine fibroid embolization, it involves the commonality of these two procedures, that there are no cuts made in the body and they are same-day procedures. First, let's talk about uterine artery embolization. Uterine artery embolization involves placing a needle in a woman's wrist or in a groin with ultrasound guidance and entering the artery, exchanging the needle for wires and catheters, and advancing wire and catheters under light X-ray guidance to the uterine artery. Once the catheter gets to the uterine artery, dye is injected into the uterine artery and the fibroid is identified. The next step is to do what they call an embolization, which means blocking of blood flow. And this is when particles that are made up of resin or gelatin are injected into the uterine artery. This procedure works because the fibroid has abnormal blood vessels and tends to suck up all the particles and takes it up permanently. But the uterus does not take up the particles. For 24 hours after this procedure is done, a woman experiences a lot of pain, which we manage with morphine type medication and anti-inflammatory medications. And the reason she experiences this pain is because those fibroids are dying and they're shrinking. 24 hours after the procedure, there's much better blood flow to the uterus, but no blood flow to the fibroids. And the fibroids continue to shrink over time. The next treatment that I'll talk about is MRI-guided ultrasound ablation of the fibroids. This procedure is time-consuming, it's very expensive, and it's only effective in treating one fibroid, as opposed to uterine artery embolization, which treats all the fibroids in the uterus in one setting. Today we have talked about the signs and symptoms of fibroids. We talked about who is more prone to get fibroids, and we also talked about the different treatments of fibroids, and that the treatments are medical treatment, surgical treatment, and interventional treatments. Treatments have a role to play in the management of fibroids, and it's very important that patients and their doctors are informed about all the available options and that all these options are considered when prescribing a treatment to a patient. In conclusion, any woman who is being considered for surgical treatment for fibroids should also be informed about uterine artery embolization, because uterine artery embolization is safe, it is as effective as the surgical treatments such as hysterectomy and myomectomy, and every woman who is undergoing fibroid surgery should be considered for uterine artery embolization to see that they're a candidate. Thank you. Thank you for watching. This is Dr. Rotimi Johnson. Please subscribe to this channel for more educational videos, and check out our website, rjmedicalgroup.com, and check out our blog. Feel free to email if you have any questions. Thank you.